Hello, I am Dr. Fernara with Phoenix Mobile Veterinarians, and I am here today to talk to you about when your dog undergoes anesthesia. With my assistant Rebecca, we are going to answer a few questions that you have for us.
Dr. Fernar, what kind of anesthesia is used for my dog?
There are two main types of anesthesia we use for your dog. The first one is an injectable form, and the second one is a gas form where they are breathing in the medication.
How is my dog given anesthesia?
With the injectable form, we are giving that medication either into the muscle or into the vein, which then will make them sleepy. Whereas with the gas form, they are breathing that in and they have to be maintained on that gas for the duration of the procedure.
What is the difference between sedation and general anesthesia, and when is each used?
So with sedation, that's usually the injectable form that we've been referring to for anesthesia, and that is used when we are performing shorter procedures. We have a pet that's painful that we need to do a complete physical exam to try to figure out why they're painful. A lot of times we will have to make them a little sleepy, put them in what I like to call a twilight zone, just to be able to perform that exam. Sometimes if they're scared or too anxious, we need to use that injectable form as well. Things like x-rays, ultrasound, where we just need them to hold still, we will have to use that too. With the general anesthesia, this is when we primarily use gas anesthesia, so they're breathing in that medication throughout the duration of the procedure, and that is used for longer procedures, our spays, our neuters, our dental procedures, anything where we need them to be asleep for a longer duration, we will use the general anesthesia.
Will my dog need an exam and lab work before anesthesia?
Yes, so we always recommend meeting with your veterinarian prior to an anesthetic procedure to discuss what will be needed depending on the procedure and the condition of your pet. Pre-anesthetic lab work is usually recommended along with a full physical exam to make sure your pet is at its optimal health to undergo that said procedure we are recommending.
How do you ensure the safety of my dog under anesthesia?
So there are many different ways in which we try to ensure the safety of your dog while we're undergoing anesthesia. First thing is a full physical exam, discussing any concerns you may have. Then we do recommend that pre-anesthetic lab work. That's going to allow us to evaluate organ function, which will tell us which medications are best for your pet. We also during the procedure are monitoring their vital signs. We have one pet nurse that is designated to your dog throughout the whole procedure and in recovery, monitoring these vital signs. So heart rate, temperature, respiratory rate, blood pressure, oxygenation, their carbon dioxide levels. All of this will ensure the safety of your pet during that procedure and in recovery as well.
What pain medications will my dog receive before, during, and after the anesthetic procedure?
Depending on the procedure and the level of pain that the doctor feels the pet is going to have from that procedure, or the amount of pain that your dog had going into that procedure, will determine the types of pain medications. We do have varying levels of pain management, and so really that's dependent on the veterinarian and the procedure performed.
How long do anesthesia procedures last?
Anesthetic procedures can vary anywhere from 15 minutes up to a couple hours. Again, this is dependent on the procedure and the condition of your pet prior to that procedure. So those are some questions hopefully we answered for you regarding your dog and anesthesia. If you have any other questions, we are happy to answer them. Please give us a call at Phoenix Mobile Veterinarians.